Good evening, ladies and gentlemen. My name is Angie Motshekga from the Department of Basic Education. We are here for the media briefing. The Minister of Basic Education is here together with the Deputy Minister. The Director General is also here, Mr. Mweli. I will not be taking more of your time. Minister, I'm going to invite you to please come through to take the space and deliver your presentation tonight. Thank you so much. And colleagues, don't forget that later on after the Minister has spoken, we'll then be taking questions. Please prepare them. Minister, please come through. So please prepare your questions and we'll be able to respond to those. Thank you.
No, thank you very much, Chair. Let me start off by acknowledging my colleague, the Deputy Minister, the DG Mweli, members of the media and officials from the department. Indeed, Chair, the coronavirus has brought a lot of trauma and anxiety to all of us as a nation and the rest of the world. And it has indeed turned our lives upside down and brought lots of anxiety. And since we started planning for the reopening of schools, we have been privileged by receiving many representations from parents and different organizations. And I must say, we highly appreciate the support and the guidance that we've been receiving from the public, and for that we are highly grateful. I'm aware that parents and children, teachers and non-teaching staff all over the country have been asking quite a number of questions about the future of the academic year and what is going to happen to them or to the year. There was always certainty that schools will have to reopen. Cabinet did agree that as much as it was important to open schools, the key principles that had to guide our work was to be informed by the safety of learners, the safety of teachers and our workers in schools, and also ensuring that as we plan to reopen schools, the reopening of schools does not contribute in any way to the spread of the virus. So we did agree that we needed to rise from the coronavirus pandemic, working closely together and move forward, albeit under very difficult conditions. If there's anything that we have learned and appreciated from coronavirus pandemic, it is that we need each other and have to work together. Because we are indeed sailing through uncharted waters, and we have mainly relied on expert advice from the medical fraternity, but also from research and information both locally and internationally, studying what the international trends are to inform our plans. Indeed, there's a whole debate on the impact of coronavirus on children and adults, and we are informed and guided by these debates, and we use them to guide our work. The forced closure of schools to slow the spread of coronavirus was a necessary step we take. It continues to remain an important step that was taken to contain the virus as quickly as possible and save lives. And indeed, the lockdown followed, and as you will know today, that is day 54, and we are amongst the first, even before the lockdown, who had to close our doors. So in addition to these, countries all over the world have been guiding us. We've been looking at trends and see what is it that we learn from them. But before I really address myself to the issues around the reopening of schools, because that's the purpose of this briefing, I really want to talk and condemn the vandalism that has taken place in our schools. We have now to date 1,577 schools countrywide which have been vandalized, damaged, and burned. We have 463 schools in KZN, 336 schools in Gauteng, and indeed this is very disturbing. It's a disturbing trend that will set us back in our efforts of trying to get back and even to maintain our infrastructure. We again appeal to members of the public to help the police and to also work with the Department of Education to make sure that we really bring the perpetrators to book. On the state of readiness. Yesterday, I met with the Council of Education MECs, ministers, and we considered the latest reports on the state of readiness for the reopening of schools. And CM did note the progress that has been made so far, and also what has been received in schools. We did note that senior management teams have received materials required. And I must emphasize this, Chair, that the materials, those 2 sanitizers, were sent for SMT, they're not for school. So people are saying 2 bottles of sanitizers for the entire schools. Those were sent for managers who were expected in schools, because we can't, with all this vandalism, we can't send our stock far in advance because it will not be very safe. But as a sector, based on the reports that we received with the MECs, we are confident that the opening of schools across the province will happen as outlined in the plans that we have developed. The reports that we received were showing that preparations have been taking place and good progress has been made. All indications are that the preconditions for the reopening of schools are going to be met. And the delivery of all the essentials is being done, not necessarily to schools, but to safe places like warehouses. And that's what we're monitoring to say, has this province received its masks? Where are they? And when are they going to go to schools? So there is monitoring at that level. And we have received reports from provinces that orders have been placed and deliveries are beginning to happen. So the items that, amongst others, that we have ordered, which are beginning to arrive in schools, are your essentials like your sanitizers, your masks, your water and sanitation. And of course, schools will be cleaned, and most are being cleaned currently. The CM agreed that provinces have to move at the same pace, and we have emphasized the need to pay special attention to the health and safety of all learners, teachers, and employees in the schools. Earlier today, again, we met with teacher unions and school governing bodies. Again, we updated them on the progress thus far about the plans, and we have agreed that next week, when we already do a countdown, we will also give them the latest report about the countdown. One of the major things that has really arisen around the plans for our reopening were around issues of comorbidities. Because the department, whilst working with the Department of Health, it has had to profile all its workers and issue guidelines to guide them on how to work or manage all these underlying challenges around health, which the Department of Health has guided on. So we are working with the Department of Public Service on this, in this aspect, and we also urge parents to work closely with the schools to ensure that learners with pre-existing illnesses are also assisted. Schools will work with parents to obtain the information, which once again needs to be treated with the utmost care. And the matter which is paramount, we appeal, is cooperation in this regard. The other matter we had to address was around the provision of water. Again, we have profiled all the schools with the shortages of water or with very challenging supply of water. So we have entered into an implementation protocol with the Department of Water and Sanitation, and we are working together to ensure that no school goes without water. We will have what we call just-in-time delivery, so that even if we had not delivered today, but by the time we get to the school, with the countdown from next week, we will be able to say how many tanks and tankers have been deployed to schools. But it has also become very clear that the virus has forced us to re-engineer the basic education system. The fundamental review of the system has become very necessary if we are to minimize the impact on the sector in the long term. However, in the short term and in keeping with the goal of managing the academic year, we have come up with several measures to help the sector recover lost time whilst ensuring that we protect and ensure the safety of our learners. The amount of time that is available is going to be determined by the date in which we face the other grades. We also had said we expect, when I made the announcement here, that we expect SMTs to arrive on the 4th, but because of challenges around ordering and the arrival of SMT, of safety materials, we've had to postpone the arrival of SMTs to a week, therefore even postponing the arrival of teachers with a week. From the reports, all provinces indicated that they will start receiving their teachers from the 25th, not on the 18th as we had planned. We also had to look at the question of school nutrition, and which has been adjusted, and we and will be aligned also to our phase-in approach. So for learners who will be reopening on the 1st of June, we have put measures in place to make sure that indeed the food handlers have been provided with your protective equipment, including gloves, aprons, and face cloths. They've already also been trained in terms of how to manage food differently under the environment, and indeed feeding will happen when the first phase comes in. Also, what we had to look at was transport. And we are working with the Department of Transport to ensure that the safety protocols are maintained, i.e. that everybody sanitizes hands before entering a bus, they all wear masks, the safe distance, and this will monitor closely or together in partnership with the Department of Transport. On the schools reopening, the National Coronavirus Command Council and Cabinet have approved the reopening of schools as of June 1, 2020. Independent and public ordinary schools will open even in the metropolitan areas, because there was also some, I have to correct this, DM, misinformation about the fact that some schools, because it came in the Sunday Times, and I don't know where it came from, it possibly is a leaked document of our earlier discussions or projections, that all schools, even in metropolitan schools, that's what our plan, they will reopen when other schools are reopening. And what we are looking at is even going beyond that, but we'll announce going beyond 7 and 12, but we'll announce that later. But what I want to emphasize is that indeed, as we were planning, as much as we were reporting at different times, that schools will reopen on the 1st of June. We will start with grade 7s and 12, but also we will also look at small schools and special schools differently, because we may not be able to use the same measurement for all those other sectors, and we will give details again during the course of the month. So all learners, educators, and support staff will receive orientation and training at the start of the school reopening, which starts for grade 7s and 12. We are aware that the impact of the virus also, or the lockdown on families and societies in general, has really created unprecedented pressure and anxiety, and therefore we've put plans in place to make sure that we can provide social, mental, psychological, and emotional support. We're working close with the Department of Health and the Department of Social Development. In addition to this, the basic education sector, using its own psychologists and social workers who had prior training on counseling, will also come on board to assist us. The other question that has been coming to the fore to say, when are we gazetting the new the new school calendar? We had, as I said last time, that we had to get permission from the NCC that indeed our plans are accepted. Now that it has been approved that we can start opening schools from the 1st of June, the revised school calendar will be gazetted soon, and it will indicate the opening and closing dates and the breaks between, and we'll work with provinces to make sure that no school is left behind. Because the 2020 academic calendar is going to have impact for the 2021 school calendar, and we need to already advise communities and parents in particular about the changes of what will happen next year. On special schools, during consultations with social partners, it became clear that we need a different approach when it comes to special schools. And we are working with organizations who are leaders in that sector, advising us on the best way forward regarding the phased approach of special schools. Because as we might all be aware that some special schools are also therapeutic centers for learners with special disabilities. Therefore, their long absence from school may even affect their health. So we are looking differently at how we are going to manage special schools and make sure that we don't make their lives or or put their lives at risk by closing for a very long time. On early childhood development, again, the easing of the lockdown restriction has also seen by many more people in addition to those providing essential services returning to schools. Because as I said last time, that schools are not only tuition centers, but schools are also social centers which provide support to communities around childcare. So as we plan through the NCC to move to level 3, early childhood development is being considered. I am in discussions with the Minister of Social Development to make sure that indeed we can announce a plan around the reopening or the management of the phasing in of ECD earlier than we had anticipated. So, Chair, I want to take this opportunity to really thank all the people who have communicated with us, all the people who have been giving us advice, and all the people who have been supporting us in this process. It indeed was not an easy process. But I also want to thank my colleagues from provinces, because the whole burden of preparations has been falling on their shoulders. I also want to thank the HODs in different provinces led by UDG. But I also want to extend my gratitude to civil society, to our partners in education, our teacher unions, our SGBs. And this morning we also had an opportunity to engage with students around our plans to reopen schools on the 1st of January. And we do trust we'll continue to walk the journey together. We have only just begun. There is a lot of work that lies ahead of us, and the biggest task will be monitoring. As in all other previous occasions, all the plans, the standard operating procedures, the guidelines and relevant documents will be made available on the DBE website as soon as they're available. Because it is important for accountability to make sure that people don't ask me for accountability from the streets to say, Minister must tell us the following. I'll tell you in advance. I will put on the website, please go there. Don't go to either the media to say, I must tell you what to do. I'm your employee, I'm your servant. So I have all the responsibility to make sure that at all times the public is kept informed and that all of us in government are accountable. I have also appointed a consortium of independent monitors to help us, because under the conditions that we find ourselves in, we are unable to move and go province by province and verify some of the information that we are receiving. So the consortium, which is independent, has auditors, has call centers, will assist us to verify information, but will also assist the public, especially school principals, to communicate with us in case they encounter they encounter challenges. So what's going to happen is we're going to have auditors which give us a schedule to say, from week 25, we're delivering tankers, here's your schedule, and the auditors will have to give me a report to say, indeed, it's happening. On the other hand, the principals themselves, who are the anchors of the system, should be able to have a channel through which they communicate with us, but also with the province, and make sure that we can mitigate any risk that may happen, because it could be possible that challenges may come on the way. And because of the dangers and the challenges that are brought by the virus, it is important to get everything right, and therefore communication becomes critical. So again, this consortium will have an independent call center through which principals in particular, parents in particular, will also be able to communicate with us and make sure that indeed we prevent any situation where we're not able to meet our obligations, though we're trying at all costs, Chair, to make sure that we really put all the necessary systems and can ensure the safety of our learners, our teachers, and our workers in our facilities. Thank you very much, Elijah. I'm sorry. I really want to acknowledge UNICEF, which has also been helping us tracing international information, helping us monitor, and the leadership of UNICEF should be somewhere here. Thank you very much for just really helping us with information and giving us the support, because we've always needed to have comparative information internationally in the region, but also what are the concerns and what is the advice of UNICEF, and also what is the advice that we're getting from the World Health Organization. I'm sorry that I didn't acknowledge you in the speech. I'm sorry.
Thank you so much, Minister. We are now going to be taking questions. We are going to start with questions which will come through via the telephone line. I hope we are ready for that so that we can proceed in that direction.
Yeah, we've got 2 callers.
All right. Can we get their names and their questions accordingly?
Okay. My name is Fred. I'm calling from Limpopo. My question is very simple. Since the minister have indicated that learners should go back to school, I want to establish or to be clarified as to what will happen with the toilets, because I heard like the minister is overemphasizing the water issue, not the sanitation issue. How are these people going to be using toilets? And then secondly, I would also want to be clarified on the issue of learners, because you may find one class having 60 learners, and then for the 60 learners that the class will be having, I just want to know the plan as to how are they going to cascade them into one class. Thank you very much.
Thank you for that. The second question, please.
John Walker, ENCA. Minister, for instance, the people who have made a case for the reopening of the economy, the premiers of Gauteng and the Western Cape have, for example, made a case as to why those economies should reopen. What case did you make? What did you tell the National Command Council and Cabinet are the reasons why schools have to open from the first? And then secondly, it's about with regard to water and sanitation. The department doesn't have a particularly good record, especially in the far-flung, largely rural provinces. What are you going to do differently this time around? What guarantees do you have from the Department of Water Affairs, for example? Thanks.
All right.
We have one more caller.
All right. Let's bring them on. Good evening. Please introduce yourself.
My name is Mrs. Sally, and I'm phoning from Cape Town.
Thank you. Proceed.
Yes, I am a grandmother of 3 children in primary school. The school has got a diversion of learners from all over Cape Town. They come from the hotspots. They come from any areas. Now, what guarantees does the minister have for those learners coming home to me who's got underlying health issues? They live with me. So what guarantee do I have that I will not get the virus? What guarantee can the minister give me?
All right. Thank you. We've heard you.
Thank you.
Thank you so much.
We have another caller.
All right. That's the 4th one. We'll take 5 if there's one more. Let's allow this one to proceed, please.
Hello. This is Mpobaloy from Tirimana High School in the Northwest. As a concerned teacher, the minister did not mention if all teachers will be going back to work or will be teachers who are teaching grade 7 and grade 12 only. Thank you.
All right. That's fine. Thank you. Can we take the last one if we have the last one in this round of 5 questions? Yes, no? All right. Hello?
Hi there, am I live?
Yes, please proceed with the question.
Perfect. It's Jevron Epstein here, and my question is with regards to private schools and independent schools. Will we be able to open up for all of our children at the same time? How is the stagnation of that going to be affected for the private sector?
All right, thank you for that question. I'm going to request the Minister to please come forward, Minister, to address the questions. And I'm going to ask that if the Deputy Minister or the DG want to speak, they will also have to come to the stage once the Minister has taken her seat. In the meantime, I'm going to ask the Minister to come through. Minister.
Okay. On water and sanitation, we acknowledge that we had a very poor record in terms of dealing with water and sanitation, but you'll also realize that because of the virus, we've had to suspend all other programs, your renovation, your building of new schools, and focus strictly on water and sanitation. Your fencing, or your painting, all of those things have been put on hold. So what has happened is that working with the Department of Water and Sanitation, the question of water and sanitation is part of the plans. You would have seen that in different provinces, part of the reports they're giving us, it's how far they have been able to upgrade and renovate their sanitation programs. In terms of many learners, spacing is part of what is also making us face the arrival. If we had enough space tomorrow, I would have said all the children can come to school. But because we had to space that in the class of 60, we possibly can only accommodate 20. That's why we're phasing in whilst we're working at other measures, which we'll announce later. Some schools already, for instance, they have facilities, are going to use school halls, are going to use tents, but to make sure that we're not we're not in trouble with spacing, which is a major issue. That's why we're phasing. So when we open on the 1st, only the grade 7s will have the whole school to themselves. The grade 12s will have the whole school to themselves. So the question of phasing on the 1st of June is not an issue. What we are working now with provinces to say, to be able to manage spacing, what can we do? There are proposals which we have to concretize about rotation. There are proposals around platooning. There are proposals about using community centers. There are proposals that we use. We also tend comfortably in schools. So there are all different proposals, but the question of spacing, it's one of the preconditions that had been put to us to say it must be the washing of hands, there must be sanitation, there must be spacing, and there must be testing every day. So to the grandmother, we will screen your child on a daily basis. So if your child brings a temperature, we will have to work with health so that the child gets screened, which helps a child so that if a child is at home, there were underlying challenges, through the screening we'll be able to identify early, which is very helpful. In terms of underlying conditions, and that's why we're asking committees to work with us, and parents must step up. They must declare what are the underlying problems that their children have. If as a grandma you know your child has asthma, you have to declare so that the school can work with you on how to manage it, because we will not be able to address and guarantee grandmother of 3 kids. What do we do? Because we have to deal with 16 million kids. So we'll have to deal with case by case without necessarily giving any individual a family any guarantees, because I don't think I'll be able to do that. The reason they say the province made a case, and all of us were making the case to say we don't want to come out of the virus and find that we don't have a country. What is it that we do? I think all adults will say that schools are good for children. That's what it's a bottom line. Schools are good for children. If you go to the township now, go to Soweto, go to kids, and kids being kids, as early as 9 o'clock, they're playing in the streets. So if we're worried about distancing, kids are kids, have to play. So which means for the past 4 months, kids have been growing up without a structure. Schools give them a structure. They'll wake up in the morning, wash, get taught for 2 or 3 hours, being fed, and go work. Home will give them lots of homework. That is what is good for children. But coming from UNESCO, and I'm glad that UNICEF is here, and I'll quote this because it's very important for me to really, and we say, why reopen schools? It's not myself saying that, it's UNESCO, it's UNICEF, and also the World Health Organizations. It says, and I quote, disruptions to instructional time in the classroom can have a severe impact on a child's ability to learn. The longer marginalized children are out of school, the less likely they are to return. And we have history around it. In 2010, when there was this long teacher strike, most of our learners, especially teenagers, didn't come back. So it says children from the poorest households are already almost 5 times more likely to be out of primary school than those from the richest. Right? If go to teams, they can have bacons and other things, but the ones that have to wake up in the morning and go and play, those are the ones that we're targeting. So if you can put your child on team school, there's homeschooling, the law allows it. We will then work with you how we examine them so that they go to the next class. But our target is this. It says being out of school also increases the risk of teenage pregnancy, sexual exploitation, child marriage, violence, and other threats. Further, prolonged closures disrupts the essential school-based services. We've not been able to provide food and all other medical like vaccination because kids were at home. So as I say, it disrupts essential school-based services such as immunization, school feeding, and mental health and psychosocial support, and can cause stress and anxiety due to the loss of peer interaction and disrupted routine. That's the case that we're making around. But the bottom line, schools are good for children. And that's why we have to make sure that we take them back to schools, make sure that we protect them against infections, and make sure that schools don't become a center for the spreading of the virus. On the 25th, we expect teachers, we go back and what the HR is working is that those with underlying challenges, what do we do with them? Those of a certain age, because provinces have already profiled how many principals are around 60, how many people have really these underlying challenges. But on the 25th, from the reports that I got from provinces, teachers are expected back because we are going to need their services. If we're saying a class of 60, we're going to break 3 times. It doesn't mean that if you're teaching grade 11, you won't have work to do. So which means we have to work with the teacher of grade 10 and grade 11 to deal with the split classes that we're going to have. If we say grade 7s come, we're going to split these classes. Some are 40, so which means they may end up being 2 classes. So the teachers of grade 5 and 6 will have to come and assist us to deal with the split classes. So the answer is that indeed, on private schools, we are engaged with them because we have decided to treat them differently in terms, as I said, under the agreement that we have on the NCC, that we will have special dispensation for small schools, because we can't treat small schools the same way we treat big schools. They don't have spacing problem. We won't have a justification why we say they cannot come. In the public service or public sector, we are phasing in because we have to manage our challenges in terms of the size and numbers of the sector. We are discussing how we deal with special schools. Most of these schools, for instance, schools of children deaf children, are actually not very big classes. We found that there are 10 in a class, so there's no spacing issue. So there's no reason why we should say they have to be phased in because the circumstances are different. So even with private schools, we're engaging with them as a different sector. with different challenges, and DG has already spoken with their representatives, and together with them we'll announce how we deal with issues that are affecting them, the way we're dealing with issues in the special schools and the way we're dealing with issues in small schools. So there'll be differentiated approach depending on the circumstances without creating lots of divisions in the system. Thank you very much.
Thank you so much, Minister. I'm told that we have a lot of questions. Someone has written to say that this briefing should end at 11 p.m. because of the number of questions that have since come through. We're not going to go to the WhatsApp line. We are going to ask Dagalani to read the questions that have come through via the WhatsApp line. We'll take 5 to start with and get the responses from the ministers and the DG, and then come back to you because I'm told you're under pressure over there. Dagalani, over to you.
Thanks, Mr. Motshekga. The first question that we have on WhatsApp is from Tamar Khan from Business Day, and the question is, can you indicate what scientific advice the department has sought and from whom to guide the plan for opening schools? And we have 6 numbers coming in, questions coming in sequence from Nadia, from Network 24. And the first one is, what is going to happen to children with chronic diseases like asthma, diabetes and others? Will they have to stay home, and how will they continue with their learning from home? And the following question is, some children's parents have chronic illnesses and fall in the vulnerable group. They run the risk of being infected by their children if these children contract COVID-19 at school. What is the department's plan to deal with this? And the following question is, can parents choose not to send their children to school? And can parents choose to keep their children at home and let them repeat the year in 2021? And the following question, many schools have indicated that they haven't received any equipment nor products to disinfect schools. Other schools received an insufficient number of products. And how did this happen? And what is the department doing to solve the problem? And the following question, we are receiving reports from parents with children in the foundation phases that in certain schools there has been no teaching happening, especially in very poor communities where access to learning support is limited. Is it not too late to rectify this situation? And the last question is, what are your plans with the matric exams, and how will it be conducted safely?
Thank you, Tlanga. The minister indicated and read the statement by UNICEF, which I will read again, that the global school closures in response to COVID-19 pandemic present an unprecedented risk to children's education, protection and well-being. The United Nations Secretary General Antonio Guterres recently called on governments and donors to prioritize education for all children, including the most marginalized, and the Global Education Coalition was established to support government in strengthening distant learning and facilitation of the reopening of schools. And there was a question, why reopen schools? Disruptions to instructional time in the classroom can have a severe impact on a child's ability to learn. The longer marginalized children are out of school, the less likely they are to return. Children from the poorest households are already almost 5 times more likely to be out of primary school than those from the richest. Being out of school also increases the risk of teenage pregnancy, sexual exploitation, child marriage, violence, and other threats. Further prolonged closure disrupts essential school-based services such as immunization, school feeding, and mental health and psychological support, and can cause stress and anxiety due to the loss of peer interaction and disruptions. Minister indicated that as we are here, children are on the streets, they are playing. We are not saying that, we said in the presentation that the lives of the children are put first, life first. But that does not mean that if we are going to stay with the pandemic for the next 3 years, it means there will be no schooling for the next 3 years. Want to thank the South African government that it has conscientized South Africans. Now wherever you go, you see people on mask, you see people exercising social distance, and these children, they live in the same societies where social distances are practiced. And we believe that even in schools, they will continue to do that. There are this series of questions by Nadia which were asked very fast, but what's going to happen for children with chronic and whatever? Minister clearly indicated on this. Parents must upfront declare. We don't want to expose any child in any form of danger. So if parents, they know the conditions of their children, and the parents, they know their conditions also. And if they declare and they come forth, then we'll arrange with schools as to how do we teach these children if they are not allowed to come to school due to their conditions. And Minister indicated that screening will be done on a daily basis. It doesn't mean that when we say schools are reopened, then we are opening a loophole for children to go and be infected. The system will try by all means that the children are as safe as possible, which means even parents will be safe if children are safe. So if the parent is chronic, yes, it is also indicated by the Department of Health that we must protect elderly parents. They must not mix regularly with children. And that, we believe, is practiced in every family. So especially chronic parents, we cannot, even now when schools are not yet reopened, those children are dissuaded from coming closer to chronic parents, especially if they are not well. So that will be maintained. Can parents choose to keep their children at home? The answer is a big yes, Minister. If I don't want my child to go to school for now and say I'm afraid of COVID-19, you will do so. And Minister earlier on indicated that we encourage also homeschooling. If you keep the child at home, but also arrange for the homeschooling of that child, because you cannot deprive a child from going to school. If you say, my child will not attend a physical school, then arrange for the homeschooling. And you will be supported if you follow all the guidelines for homeschooling. There's this thing that schools in poor communities and rural communities, education there is not as effective as schools in towns. I don't know, maybe if we can get that report where there was no schooling because the community is poor, Minister. Because if a school is in a poor community and in a rural community and there's a qualified teacher who is teaching there, what is the reason for that teacher not teaching? And if that was prevailing, that should have been reported. And even now we are calling upon parents that if there is a school where there's a teacher and a learner and the teacher is not teaching and the teacher is at school, that case really must be reported. So we would love to have that report where there was no schooling in a poor community. What are the plans with matric? Every time, this is the second time the department is presenting. And we said the matric paper is ready. Minister, when he was making the statement, she indicated that the curriculum for the internal grades will be trimmed. But in matric, the curriculum cannot be trimmed. That's why we say grade 12s must go first to school so that they cover the work that has not been done by teachers. Because we believe that, because every time there will be a cry to say the e-learning only benefit those who come from affluent areas. Those who come from deep rural areas do not benefit. And now we are saying, let children go to school so that those who come from those rural areas should benefit from their teachers, that there will be a teacher in front of the learner. And that will also cater for those that are doing grade 12. Because the paper has been set long ago, is ready. They are going to write a full paper, but the time for the curriculum coverage is the one that they were supposed to be writing in October, November. They are no longer going to write in October, November, so that they cover almost everything before they sit for the examination. But Minister indicated that we are going to, that is going to be determined, and the dates exactly will be made known, and they will go to the website of the department and will receive that. Minister, there was a question about my school did not receive. What is it that they did not receive?
Equipment, and I said,
Oh, Minister said from the 25th of May, we start to count down. As we speak, gathered today here, some deliveries are made today, some will be made tomorrow, some will be made next week. So we cannot complain now that there are no deliveries, like what Minister indicated, because there are social media activists. When we say SMTs will report to schools on the 25th, then the sanitizers for the SMT is delivered to school. Then some social media experts, they start to say, yeah, this 20-liter is for the whole school and for the 400 children. That will not be the case, because those that are coming to school before are the SMT members. And as they come, they must be sanitized and they must have all the PPEs, which is in accordance to them. We cannot, when we are expecting 4 people and deliver for 50 people. So whatever that is delivered for 10 members of the SMT is not for the whole school. For the whole school will be, the Minister spoke about vandalism. If we deliver everything at a go, how sure are we that the same communities will go, instead of protecting those PPEs for their children and teachers, they will go and say, there are my PPEs there, I'm going to take. So that's why we deliver for the SMTs, then for the learners will be received by the same SMTs. I think, Minister, I've covered some of the questions. Thank you very much.
there was also, DM, a question about what scientific evidence we have. We're working under the Department of Health. We have officials who are full-time deployed to interact with the Department of Health around our plans. So we work under the, even guided by Professor Karim's team, but also on our part as a department. The researchers that we had employed to do other research work for us under normal circumstances, tracing or monitoring our reading programs, are not able to do it now. So what they do, they monitor international trends, what is happening in France. We only got today from the team to say in the French school they found children who tested positive. They will also give us information to say in Denmark there's never been any infection. They will tell us. So we're monitoring, because we are also equally concerned about the safety, and also in view of the fact that we're dealing with something we don't know, information is key. So we have to be guided by facts. And that we have acknowledged from the word go, that we have to be guided by facts. when I spoke here, I said there's a body of information around how children are not infected, how adults are being infected. Just yesterday, Dr. Kumalo, who is a medical doctor who works in the department, was giving us statistics because they even monitor individual by individual who's passing to say how many of the people who've passed away are 2 years old, how many are 5 years old. And the report she gave us as late as yesterday, that there's 0 death for 0 to 9. And it's in line with international trends that 0 to 9 is the safest. And that's why even the phasing in of schools in other countries is starting with the younger ones based on information and facts. So I can really assure that we are equally concerned, we're not negligent, and we are guided by facts. And even when we were saying we're going to open on the 1st, we were tentative. I said we are proposing. NCC will not have agreed or allowed us to proceed with our plans if they really, in their assessment, our plans were not safe. Our plans had to really be assessed. It had to go to the NCC for risk assessment. And that risk assessment is informed by facts. So I can really assure everybody that indeed we are using facts. What you also didn't answer, dear, because somebody was asking to say there have been problems in the past. What's wrong with rectifying that which was wrong? If there's something wrong that we have done, the sensible things that you make right. It can't be wrong to make right what was wrong. So I just thought I should say that. There was also, you answered the question about matric. Children with underlying challenges. I also want to emphasize that every child is important. It's our slogan that no child should be left behind because every single child is important. But what also can happen is that every child's future should be dependent on other children. So we'll have to deal with problems of children with underlying problems case by case. But we can't link every child's problem to say, yes, there are kids who've got asthma, yes, there are kids who've got asthma. But there are kids who don't have asthma. So those who don't have asthma can't be held back because there's a child with asthma. So what we have to do is to deal with problems of every child case by case, bearing in mind that indeed every child is important. So we have to find ways of case by case saying how do we assist this child who is in this situation. So DM is quite correct. If you still feel anxious and doubtful, it's understandable that you can't send your child to school. But that can determine the future of every child. SASSA allows you to homeschool. There are organizations on homeschooling. You homeschool, but you have to register because the law of the country says every child under 15 has to be at school. So if you decide not to school, SASSA allows you, the South African Schools Act allows you to homeschool. You have to register your child as a homeschooling. You have to give your province and your circuit the plan to say, this is the homeschooling, this is the plan. And the circuit should also assist you to say, here's the curriculum. Your child is in grade 4. If you want that child to be promoted, they'll have to write certain exams. There are bodies which also do exams and tests for children who are homeschooled. But if you feel you want to live there, you have to apply. Don't assume that you'll walk and find the space. So if you decide not to have your child coming back, apply for your child to repeat the grade. Again, there's no quarrel about it because the anxieties are understandable. But what I really always appeal, you can't determine the future of everybody on the basis of somebody. Everybody has to be given a chance to be in terms of the opportunities that are there. So we won't close schools because there are kids whose parents are anxious. What about parents who are not anxious? We can't close school because there are kids who are not well. We acknowledge that and we're saying let's deal with it case by case. But we can't determine the future of the nation on the basis of other children. It's not correct, important as they may be. Thank you very much.
All teachers are coming back.
Oh, the reports I got from the provinces, because they're the ones who employ teachers. The reports I got on the 25th, teachers all. Let's clash with song. Re hirilwe kaofela ka di 25 ra theoela. Ke re thotse moputsong ena wa rona wa May re tla fumana le wa June, so re ka di 25 ha re lo sebeletsa kaofela re tlo kgona ho thusa ka ditsela tse ding akere tse ka ke hlalositse hore ha re arohanya ma grade 7 re tlo hloka maybe bo tshire ba bararo, so ska dula hae o re nna ke ruta grade 5 tshwantse o tle re na le mosebetsi for wena. Ra leboha.
Va ri mathicara hinkwenu hi ti 25 mfanele mi tlhelela swikolweni. Hi leswi minister a vula swona. Thank you, Minister. Thank you, Deputy Minister. Tagalani, let's come back to you to try deal with some of the questions that have come through. Please make sure that those who have already asked questions, we don't go back to their questions. We need to deal with new questions. But also, if the questions have already been asked or the answers have already been given, please let's go to fresh questions that are seeking new information. So I'm going to hand over to you right now to read for us. Please remember to slow down a little bit so they can take notes and not miss out on other questions. Please proceed.
Thanks, Mr. Mhlanga. We have a question from Sophie Mukwena from the SABC, and the question is the department going to make special arrangements for learners who cross borders every day to attend school in South Africa? For example, learners who attend school in Lady Brand but they live in Lesotho. And we have another question from Samkele Maseko from the SABC. Said some school governing bodies in KZN rejected government's plans to pass over the responsibility of curbing the spread of the coronavirus in schools. What had the department done to bring the SGBs on board? And the following question is from Hajra Omaj from Power 987. What is international best practice government looked at in drawing up these proposals? And she said nurses, police, the SNDF officers have been in front line. Now teachers are being asked to step up too. Does the minister believe frontline workers in general and nurses and doctors in particular should receive a danger pay for treating patients with COVID-19? And the following question is from Nazir from Glow TV, and the question is, will learners be allowed to have haircuts prior to going to school? And furthermore, in order to avoid sharing and other contact, will teachers still mark books of learners? And the following questions from Sheldon Moraes from News 24. The minister says the process will start with grade 7s and 12s and small schools. While more details will be given later this month, can the minister give an indication of what factors determine a small school? Okay. And the following question is from Teboho Monyo from Radio Riverside. The question is, by when can parents of other grades not opening on the 1st of June know what the plans or dates of the department are to return those learners to schools? And will the psycho-social support services to learners and teachers be for all public schools, or will it be only for selected schools?
Thank you so much. Thank you for that. We also have two calls. We also have two questions that are coming through via the telephone line. We are going to take those and add them to this batch. And then after that, we'll then ask the panel to address the questions. Can we have the first call through, please?
Hello, good evening.
Yeah, good evening.
Thank you very much. Katle Khonyoni from SABC News. Minister, there's been mounting criticism from stakeholders in Limpopo against the provincial education plan to redirect 45% of its budget at no-fee schools to cover COVID-19 expenditure. Has the minister been briefed about that, or is the circular which was released a week ago still subject to further deliberations? What will happen, basically, Minister, at the no-fee schools prior to the reopening? Subject to further deliberations. What will happen?
We can't hear you anymore. Your
All right.
net. Please proceed.
Yes, sir. Mr. January, I'm looking at ENCA. Hello?
Yes, please proceed with the question, ENCA.
Yes, I'm calling from, I'm looking at ENCA.
Oh.
I'm calling from Kimberley, Northern Cape. My question directly is that the screening, who is going to administer screening at the schools? Is it qualified people? Is it going to be teachers who's going to administer the sanitizing? I'm looking at the timetable at the schools. Who's going to ensure that the timetable at the schools are going to ensure that we work within the scope of the PAM document? We teachers are employed to work for 7 hours. Will we be employed for extra hours at the schools? Will we get extra time? Thank you very much.
All right. Thanks for those questions. We are now going to try get the answers from the ministers as well as the DG. Minister, do you want to go first? Thank you.
I probably missed other questions. Yeah. As I said, I left other questions, but UTM will assist me. In terms of learners who are cross-bordering, so it was noted that not only, for instance, in this, because under level 4, there was this issue, or even level 3, the issue of even inter-provincial movements. People staying in Guamhlanga, working in Tshwane, people coming from Rustenburg, but also cross-border in terms of Botswana, Mozambique, and Lesotho. Today, I even got a call from the ambassador of Botswana to really get a proper explanation as to what is going to happen to the Botswana nationals who go to schools in South Africa. For instance, like kids who go to school in your, it's not Rasimek, Ramatlabama, who really come from Lesotho. So that matter is on the table. It's being dealt with by Home Affairs, because according to the guidelines, they have to be quarantined for 14 days. But what if they go back home every day? So it's a matter that is being attended to, and I'm sure the Minister of Home Affairs will pronounce on that. It has been brought to his table. What is a small school? A small school is a small school. It's a school that is small in terms of numbers. For instance, there are schools which have less than 125 children, but some schools are as small as 95. So when we said to them, for instance, we are phasing in a grade 7 only, they say to us, we are multi-grade teaching. 25% of our schools are multi-grading teachers, especially the small schools in deep rural and also in farm schools. And they will say to us, it doesn't make sense to get the whole school opened for 7 learners who are grade 7s. We normally teach grade 7s and grade 6 together. So we need a different dispensation. That's what they were saying. There are also small, as I said, a small school where you have very less kids. If they have adequate facilities, right? They are less than 100. They can distance 1.5 meters away. They're saying there's no, so why are you keeping us? Because we can meet your health protocols. And that's why we are then agreed with them to say, let's really look at a special dispensation because it makes sense, right? Some of them use scholar transport. So you're saying the bus will carry 5 learners, whereas all 30 learners will benefit if we were to send them to school. That's what we are saying, to say whatever we implement should not be dogmatic so that we are not able to address the needs of children. In terms of psychosocial services, again, it's not specific schools. The way we provide psychosocial services supported by NGOs in that space, it's case by case. So what we normally do even now, districts and provinces have these psychosocial services, and then schools will source them from districts. But because the challenges might be more, not even now with grade 7 and 12, we might need to, and that's why we ask health and social development to give us more capacity, because the current capacity we have might only be helpful for the first phase, but when we deal with other phases, we may need more capacity. That's why I mentioned it. And then on schools that have been removed, that their monies have been removed, are really, we have agreed with that in the sector, that coronavirus takes the priority. And that's why there's no music, there's no singing, there's nothing. And all the resources that we had to crowd them in to deal with the new challenges that we have. So I'm not sure what the MEC of Limpopo has done, which is different from what we have done. Because even ourselves, we had to take away the budget of other activities. There's no more traveling. So it will not make sense if DG doesn't take the traveling money that we're using to go and report to Parliament. We now report to Parliament through the phone, so which means we need that money. There's no longer, as I say, your music competition, there's no longer athletics, there's nothing. So all the other resources that we had, were taken towards dealing with the virus. For instance, we in buses, we can't use the budget the way we had planned to do it. In the buses, we could have perhaps been using one bus to carry 60 learners. We might find ourselves only being able to carry 20 learners. So which means the budget has to be redirected to deal with the new reality. And that's what provinces have been asked to do. On the other, I don't want to deal with labor issues through a press conference. What we are planned, PEM, we are planned. So we'll deal with labor issues with your labor organizations. We have all, we have recognition with 5 national teacher unions. So let's deal with labor issues there, so that I don't answer things to say, I know you're going to work for 6 hours or 7 hours. That's a condition of service issue. We'll deal with it there. In terms of parents, again, today, I had a meeting with all SGBs. So what we expect them to do when they go to provinces, they cascade the information to provincial structures, to regional structures, and improve communication. So I will really appeal to parents in the provinces through their organized formations, because sometimes parents wake up in the morning and say, I'm a parent, this is what you're supposed to do. And I always say to them, I have more than 10 million parents that we're servicing. So we can't deal with parent by parent. We can only deal with parents through associations, important as they are. But parents, as I say, and understandably, they write to me. If you see my phone, they write to me as I'm a parent. And I say, you know, you're parent number 13 million. So how do you expect that I have to take directives from parent number 13 million to really direct the sector? What will help me direct the sector is when you work through your organized structure, then you are able to engage. And that's why we engage them almost on a weekly basis, but only through organized formations, because we can't deal with individual parents, important as they. I don't want to underestimate their importance, but it's not humanly possible to deal with parent by parent. So, DM, ngibhala slow man, konke engicabanga ukuthi ngizishilo.
Children will be allowed to go back with their haircut.
Schools are run by principals. Let's leave the principal to run the schools. Because that's the other thing, was also in terms of how we're dividing. I mean, also, we had a meeting with SAPA, the South African Principals Association, and they emphasized that it shouldn't be that when there's a crisis, we just create a situation or some sense that they're not there. They're there to run schools. So principals will be guided because the whole question of code of conduct belongs to schools. So for now, to be on the safe side, let me leave it to school because the code of conduct belongs to SGBs and belong to school. Where they want their children haircut, long, what, pink, blue, let's leave it to the code of conduct and let's leave it to the principals and the school governing bodies. Yeah.
Which one? Minister? I was checking with MEC Limpopo. She was saying, no, the minister answered that question correctly, that schools and everybody in the province, they know that we prioritize because now the priority is COVID-19 in the country. So like Minister indicated, that money that was meant for sports, for whatever, will be taken to address issues of COVID-19. So again, MEC from KwaZulu-Natal, the question by Samkelo Masego, says the SGP is from Evergreen Primary School in Pinetown. They have withdrawn that letter. They said they did not understand. Now they understand. So there's no longer an issue of SGP complaining about rejecting the plans of the KZN. They've gone to the department to withdraw the letter. So the MEC indicated to us. Minister, there's a question about haircut. I didn't understand that question, haircut, because a school has a policy, but at the same time, children have rights. I mean, whatever we do at schools, you cannot just decide to cut we know there were cases about children whose hair were cut by schools and the consequences thereof. So unless it's a special school where parents signed specific undertaking with the schools that the hair of their children will be cut. But what we know is that the children must be neat when they go to school. Yeah, the Minister, I think you have covered all except, which one did you?
International best practice.
The international best practice regarding the COVID-18. That one was answered. COVID-19. COVID-19. Bazangikhipha nami kusasa sengithi COVID-19. 19. Minister, that one was in the presentation, it was answered. And again, when Minister came for the second time to respond, she responded to that one, that South Africa does not live in isolation of other countries of the world. South Africa is part of the global village of the world. So whatever we do, we learn from other countries. Like even today, Minister indicated that there is a report that we got from about France. So many countries in the whole world, the learners have gone back to schools. We are not saying there are no challenges. There are challenges, but learners have gone back to schools. So we are learning from international countries, and some people will also criticize and say, why are you benchmarking with countries outside Africa? We must benchmark with Africa. And in Africa, South Africa is top when coming to COVID-19. So in other countries, there are countries even in Africa who have zero infection. So when we go outside to those countries whose infection rate is almost the same as ours, and how did they respond, and we learn from them, I don't see anything wrong, and that has been done by the department, and we're still doing it. It's not something that it's an ongoing thing. We cannot say that we are done and is closed. Yeah, Minister answered the issue of parents, because by when will parents of those learners, Minister, I think this one they were referring to learners of grade 11, all the other internal grades. Minister will come again here to brief parents and teachers as to what is the next step. We are under level 4, preparing for level 3. So we'll be coming again for level 2 as to what is next. Minister clearly indicated that. So there is no way that we'll just sit down as a department and with MECs in provinces, then we decide, then children the following day go to school. We'll come and consult, communicate to parents, same as what Minister is doing, what she did today. MECs will cascade also down to provinces. So parents will know on time when will their children be going to school, all the other internal grades. I think, Minister, we've covered all the questions. Thank you.
We have 2 callers.
We will come to the callers. We just want the DG to add something, specifics on the international best practice, and then we'll come back to the questions, and then we'll take it from there. I like the WhatsApp line though, but it's fine. DG, can you please take the stage?
Okay. Thank you very much, Mr. Motshekga. Let me just add to the issue of international best practice. Experts in the field of medicine and the field of research indicate that there's very little that we know about the novel coronavirus, given the nature of this virus. But what is important is that what we knew in November 2019 and compared to what we know now, we know much more than we knew then. And we know much more than we knew even 2 or 3 months ago. As the minister said, we follow what international bodies are telling us about the COVID-19 and the reopening of schools. And you know that both in Europe, Asia, and other parts of the world, countries have started to go back to school. And when we quoted some of this evidence, as Deputy Minister said, many people said you comparing apples with other things. The difficulty is that you can only draw lessons to countries that have gone through this. I've listened to Professor Karim and his team when they followed the novel coronavirus. Now and again, they will draw their examples from these countries. At least for now, this is where we can draw lessons. The minister also indicated that with a team of researchers in the department focusing on trends internationally. And this team has been picking up incredibly valuable information in this regard. We go to the extent of even reading medical journals such as The Lancet. It's a very popular medical journal in the medical field, documenting evidence about this. But I must caution that the emerging research information is becoming increasingly large and somewhat varied and sometimes confusing. In other words, you can even use some of it to support whatever argument that you want to advance. So we follow the best in the country who are advising the government of South Africa, and we also follow international bodies who have the leverage of reaching out to the globe to get expert information and look at what is happening internationally. That's what is guiding the work that we do. And I must conclude by saying we always maintain that we are in a public health crisis. And the public health crisis has precipitated an education crisis. And if we follow that logic, anything that we do must be led by experts in the area of health, the Ministry of Health, the Ministry Advisory Council or Ministry Advisory Committee, and as the Minister said, we are led by the National Coronavirus Command Council, which also draws its wisdom from this body of knowledge, and as the President said several times, that he is guided by the best scientific evidence available. And we follow that example of the President. Thank you.
Thank you so much, DG and Deputy Minister and Minister. We will take the last round now. We are seeing on the WhatsApp line that some of the questions are repetitive. They've already been addressed. So we are also going to allow for people to also read the statement because it's got some of the detail that people are asking for. But let me start with the telephone line. I think you said there were 2 callers there. And then we will then come to the WhatsApp line for the last time. Can we please get the first caller?
Hi, Elijah. Sandra here from Eyewitness News. I just wanted to ask, Minister, what happens in a situation where some schools don't have personal protective equipment and have not yet received water tankers by the 1st of June? Are those schools going to be allowed to accept pupils, or are we going to see a situation where some schools are allowed to resume classes while others are left behind? Can you just please clarify that for us?
Thank you so much. The second caller, please.
Thank you, sir. You're speaking to Tandy Bonus from Itigeletu in the Eastern Cape. I've got a couple of questions, 2 or 3. I get a sense that the lives of teachers, learners, and school staff is being gambled with here, taking from the presentation by the DBE. This is so because I do not get clarity in terms of who will do this, bit of clarity with regards to that. And secondly, what guarantees can be given to school staff, teaching and non-teaching staff, that their schools will have been sanitized by the 25th? And what guarantees is there? I understand that the minister mentioned that delivery of PPEs and so on would be at warehouses. But what guarantees, again, are there that these PPEs will be in schools by the 25th of May? Noting very well that our DBE, unfortunately, does have challenges, well-known challenges, when it comes to delivery on time. You know, look at school materials, where you've got schools that still don't have textbooks, which were ordered in 2018 and 19 and so forth. So in this particular instance, what guarantees are there to ensure the safety of all people working in schools? And then thirdly, what would be the action, or rather what should be the action taken then by school staff, teaching and non-teaching staff, if by the 25th of May they get to schools and they find that the conditions which were supposed to have been met in order for them to start working are not met? Will there be a threat of no work, no pay, or what action can they actually take to safeguard themselves, you know, from this? I don't want us to labor on the assumption that teachers are relaxed at home and don't want to go to work. We do have in South Africa a bunch of good teachers willing to work, but I think it would only be fair that their safety is guaranteed as well. You know, and I agree with what the department is saying, that South Africa does not operate in a vacuum. we operate within a global village, or so to speak. But we should note as well that we have very unique circumstances, very unique challenges that are facing South Africa, where we still have schools that are using pit system toilets. We still have schools that do not have water and so on. So I really think that these issues should be dealt with thoroughly. We all want to go back to school. We want our kids to go back to school and so on. But we should not be hasty in terms of subjecting people's lives in danger when we've got unique circumstances and challenges that are facing South Africa. So I would be happy if the minister and the cabinet would be able to shed more light with regards to the factors mentioned here. I thank you very much.
Thank you so much for that. Let's now go to the WhatsApp line, please. Dialane.
No, thanks, Mr. Motshekga. We have Mahlak Komane from SABC News, and the question is on sanitation. How many of the 3,000 schools as of today have had water tankers delivered? And secondly, will all schools, children, regardless of quantile, be provided with masks and sanitizers? And we have Thabo from Rainbow FM. Minister, at schools where classes are overcrowded with limited social distancing, how are you going to manage that scenario? And secondly, vandalism at schools, what security measures have you put in place to ensure this is managed? And we have Mandy, and who said, what will the department do to encourage parents to send their children back to school? And will there be any kind of penalty of those who choose to keep their children home out of concerns for their safety? I think this question was answered, Mr. Motshekga. And we have Noku Kanya from Jacaranda FM News. The question is, with the phasing in of grades from highest to lowest, what provisions will be made by the department and schools to ensure people are not left too far behind? And secondly, schools that have better access to resources have undertaken online learning in the interim. How will the department bridge the gap between these schools? And we have a question from Koli Mngambi from ENCA. The question is, was the National Command Council decision to reopen schools done in consultation with the Ministerial Advisory Committee of Health Experts? And secondly, and was there some kind of data that this decision was based on? And we have Zahid, who said, what are the proposed phasing in dates for other grades? And secondly, is there an exemption from the phasing in process for schools with less than, for example, 100 students or learners? And will they be allowed to bring in all learners at once? And we have Tumelo Zulu from SABC Channel Africa, and then the minister is addressing the nation. Okay, it's okay. Let's go to El September from San Querant, and there is a possibility of educators either testing positive or being a contact of a positive case and will need to go into quarantine. The question is, are plans in place when this happens, and could that be shared? And secondly, should there be an increase in educators at a school being absent due to this? Will that school close, and what happens with learning? And we have now, how do children separate from elderly primary caregivers with underlying health issues, especially in poor areas, and there is no option of home schooling? And we have Ayandam Tetwa from Daily Maverick, and has worked to rebuild the 1,577 schools that have been vandalized countrywide started in preparation for the reopening. And secondly, can the department share with the public and medical advice and research being used to support the rationality to reopen schools in a document form. And we have Otumelo Zulu, at least we have taken one question from him. And okay, that's it for now, Mr. Mhlanga. Thanks.
All right. Thank you so much, Tagalani. Yeah, it's indeed now clear that those questions are repetitive. I'm sure even as you are reading, you can see yourself that some of the responses to those questions had already been given. But I'm now going to ask the Minister to address those questions. And as we indicated, this is the last round. Some of these questions, the answers are contained in the standard operating procedure. They are there in the guidelines, they are there in the checklist, they are there in other documents that the Minister said would be available on the website. So from tomorrow onwards, you could go there and try go through them. The detail is actually in those documents. Minister, over to you.
On screening, when we go to malls, we have security guards screening us. So it's not a very specialized area. So you put that temperature on the forehead, it tells you whether the temperature is high or low, and if it's normal, you allow the person to go through. But different provinces have different plans. For instance, Gauteng has mobilized the young people who are going to be their coronavirus soldiers, and amongst other things they're going to do will be to assist with screening, escorting. So different province has its own plan. Other provinces, what are they going to do? They're going to use extended public works people so that they engage them, they're able to get extended public works. Other schools, what are they going to do? They're going to use teachers, because parents sometimes don't even want strangers. They're going to have people that they don't know in schools. So school by school, province by province, will be working on screening. But I just want to repeat the point that screening is going to be done differently. On sanitization, the experts tell us the virus sits for 8 hours on a surface. So when teachers go to schools day one, we would have cleaned schools. There won't be any contamination that would have happened. We've been away from schools for 6 weeks. So there's no, or 7 weeks. Yeah. So there's no risk that the place is contaminated now. So what we're currently doing, we're cleaning. But as soon as people come in, the guidelines are saying on a daily basis, before learners or teachers arrive, the school must have been sanitized. And the classrooms must be cleaned. How are we going to do it? Because we don't have enough staff in other schools don't have employees again, and that's why money is being shifted from all other programs, because money has to come to this war against the virus. Other provinces will use your public works. Other provinces will be encouraged to employ more people to also help to create jobs. So again, plan by plan, province by province, depending on the material conditions. So what is important for us is that these protocols are done. The schools are cleaned. Who cleans them? The province will have to work on the detail. The schools are sanitized on a daily basis. Who does it? Whether it's public works, whether it's independent contractors, it depends on the plans of the province, but it must be done. So what we have to do according to health guidelines, we have to make sure that the following things happen, and that's what we're working on, and that's what we're proving. Guaranteeing, it's a very difficult one. Guarantee this when people are safe. We're saying we are doing everything in our power to protect. It's not as if we are so khohlagalat that we really would plunge people to benzeni. So what we're working on is to put all the necessary safety measures, and that's what I can really. So good ngeke uchase emoto emsebenzini or I guarantees are with all the respect, and I don't think and agree. I don't want to assume that people don't want to come. People are rightfully anxious. Rightfully so. And therefore we have to work with them, but I have no reason to doubt. Otherwise I have to say hi, because I can't guarantee. Says I made land. Pansukibiza wrong. Ngibize ngegama layo. Says corona. Says I made idlule mhlambe izodlula ngo-2022 ngoba asikwazi ukwenza ama guarantee. It's not possible. And that's why I opened the economy. We're not saying we're going to open the economy to level 3 because we show ukuthi there won't be infection. Impilo fanti iqhubeka ngithi. Kodwa fanti sikwenze ukwenza sure ukuthi abantu bakhuselekile. Mara akabatli luitlama busumo ke ra ke a tshepisa ana motho a tla hlokahala hona motho a tla bandi kotsi re tla leka ka hohle mo re khonang ka teng gore batho ba sireletsehe obane ha ho hlokahale gore batho ba kengwe kotsing ibile a sintho e nepahetse so ha re planele ho lematsa batho because it's as if now we plan if asikwazi uguarantee ukuthi dai sesiplan ukubulala abantu. We're going to, and we're saying yes, look to go to when you're testing the waters. Hey, and so how dibili? I want to hear about you how testing again as Kubeg. Hey, Mount your bond to go well, and find to shashale move good. I hambing a lend lebesi missing. So things so guarantee good I long full of so well, jobbing it is so well. So bengakhuluma iqiniso okhona ukuthi ngithi sozwa sonke futhi sibambisene ukuthi ngayithi asebenze masihlehleleni emuva. It's in the interest all of us for this thing to work, and when it works it's when everybody is safe. So I really want people to goodness time we are not that irresponsible but what we do. The tankers are set 25k countdown because with all the problems that we have we can't deliver all the stock, so we beg kuyagqekeza abantu bafuna ukudla bafika sebefuna ama-mask sebegqekeza sebefuna into ezithize. And teachers know what the system is. We only, even the books, as is thumeli ngo-December isikole mhlambe, unless we have very safe storerooms, we send them towards the day. So there's a term they call on-time delivery. Just on-time delivery. So temba unti sizofika. Mazingafiki ngeke sithi abantu abayisikole kungekho manzi. Right? But ke makuwela sizotsho mase kuthi akungeneki. Kodwa manje siyaqhubha ngalomfula. Siyalungisa isiwenqe lomfula. Kodwa makuwela sizoba neqiniso ukuthi asibona ukuthi khona isigodi la khona into engazilimaza abantu. Ama-mask we have indicated in the past, maybe I didn't say it in this speech because I had said it in the past. We are going to provide 2 masks for all the children in all the quintals. And that's what the province is telling. So, okwamanje, ngoba sivula 7 no 12. Mantu ama-mask ayi-10, ama-grade 7, A5. Ungangitsheli ngesikolo sonke sabantwana abayi-100. So, sithenga ngokuya ngesidingo, but what we have committed erithephiseng yona ko re tlo fana ka di-mask tse pedi ngwana o mong le o mong tse hlatswehang. Ga di fihla hae batswadi le bona ke boikarabelo ba bona hle ke ntho ya rona kaofela ke kotsi e re lebane le yona kaofela. Di a hlatsuwa hore a tlo e sebedisa tsatsi le latelang. Ha e se e lahleha ke mo re kopang motswadi hore eka wa khutlisa. So le teng tshwantse bana re ba rute ebile re na le yona program re tlo e qala ho isa mo re rutang bana hore ho tshwanetse hore ba etse eng ho itshireletsa le ho sireletsa bana ba bang lefung la corona. Hore dikolo ba re how guarantee dikolo bana di thubo tjeka dutse mo ka tshepisa mang hore ke tseba ja hore thubuwa sekolo se feng. So se re se kopang gore setjhaba se re thuse, right? Hore re sireletse the facilities tsa rona. So it is, and that's why I started it off in my presentation, Elijah, that this vandalism of schools, it's a big problem. And we are calling upon every parents, communities to assist us, right? It is our joint problem, but again, on the phasing dates, as I said, we'll deal with this day. Angit masa amanzi ngeke ngasi sofika nini kulo yamfula ngisawazwa step by step. Okwamanje siwazwayo ila ka 11 no 7, ka 12 no 7. After isikhathi sizozama lamanye sithi asesila. So we will announce dates of the different phases as we continue. What we have also requested for schools to do, especially in communities where child minding is a problem, parents are going to work, if they can, even if we have not opened for the phase, to open for the school nutrition and also for the books, for kids to come and collect books. But again, that will depend on the capacity of the sector to do that. Small schools are treated differently. That's why I mentioned them. I said if it's a school of 75 children, the grade 7s are 7. There is no point in saying they cannot bring 5, 6, and 7. The main thing is the health protocols, if they can space properly. That's the main issue. If they can meet the health protocols, we should be able to treat them differently. On the deployment of teachers, again, because this thing, it's very, absent. What we are currently doing, we are profiling teachers who have reported underlying problems. We're looking at our database of our teacher substitute, but we are also looking at a database of qualified teachers, and there's quite a lot of them who have not been employed, to see if we can bring them to the pool. And all that detail, I can promise you, we are working on the details. On where schools have been vandalized, the report is telling me that provinces are busy, not necessarily rebuilding. In some instances, we chill a staff room, which means we the container, because we won't have a staff room by the 1st. So again, provinces, so report dire, ba shebane le seo, ba se lokisa, empa ho tla sebediswa ditsela tse fapaneng ho ya ka sekolo ka sekolo. Ngiyaxolisa ngikhuluma ngeSuthu, ngathi ngaba ngithethe nangesixhosa nento. Siyavana mos melithi mhlambe nabesuthu bake beva ukuthi ngithini. Andizuziphinda mhlawumbe dithemba ukuthi nivile, because ezinto esizibuzwa besike saziphendula ngesilungu. Bese ndithi nje ngithethe ngeSuthu before ndigoduka ke ndibona uba nabantu bakuthi bayeva. Kodwa ke njoba nditsho sizama ngakonke esinako ukuthi senze sure ukuthi maya izigozivula wonke umuntu ukhuselekile. Asiplaneli ukulimaza umuntu ukuthi can you guarantee if we're planning, asiplaneli ukulimaza umuntu. Sifuna sisebenzisane na wonke umuntu ukuthi minister uyibonile lento ezawusifaka ebungozini, kodwa kungabi nento enza umsindo ukuthi sisonke kulento nathi sixakene nento kuba bekuya ngathi ngeyingekho lento. Ngoku sithi masibambisaneni senze ukuba show ukuthi wonke umuntu ukhuselekile, akho umuntu ongene ebungozini, kungabi nento futhi ebangumsindo, because njoba ndithi sihlase into esingayaziyo nathi, and ukuthi siyinqobe kufuneka sibambisane, kungabi nomsindo futhi kungabi nokusolana ukuthi ayikho le nkohlakalo ekhona esiyenzelwayo ezawusifaka engozini. Asizimiselanga kufaka anybody engozini. Rilika ka hohlo re mntu omo le omo usireletsehile. Ke a leboha.
Somebody is asking me on Twitter that, TM, you are multitask, you are busy on Twitter and you are busy there. And again, they are complaining about you, that you don't have gloves and the way you wipe here on Twitter. It's not me, it's Twitter people. I'm a Twitter expert. Minister, I think the question that you didn't cover is this teacher from Eastern Cape. I can tell. She even said, we are prepared to go back to school. Then she changed it. No, as parents, we're prepared to take our learners. We care for you, our honorable teacher, and we know that teachers are hard workers and teachers are a resource for the department and for the nation, because they are the ones who prepare the future of this nation, of the country. So there's a question that she asked Minister about what action will be taken if a teacher arrives at a school and find that there are no PPEs and then the teacher goes back, then will there be no work, no pay? I don't know. We're not making a lip service here. We are working with provinces. And as we speak, deliveries are happening in provinces. And in some schools, deliveries have already taken place in schools. So there is no way where teachers will come to a school and find that there are no PPEs, there are no sanitizers, there are no this, then that will compel them to go back. So we are fighting this COVID-19 together. We are not after any other person because we are all together in this. Teacher said teachers are not lazy. It's a fact, teachers are not lazy. And wherever they are, they miss going back to school. And we really, really appreciate that. Minister, there's this question that how are you going to encourage parents? What the minister is doing now, at this moment, is encouraging parents. All the parents at home who are listening to me now, we are encouraging you to allow your children to come to school. We will work with the Department of Health and everybody to make sure that the children are not put to danger because they are the future of this country. Uminister bekasho manje athi asisabathakathi ukuthi sesifuna ukubona abantwana bafa. Sithembeni because uma unganayi investment labantwana. Ma ungena investment kusho ukuthi awukahlakaniphi. So ngakho ke sithi bazali vumelani abantwana beze esikoleni. Uminister ukhulumile uthi mhla 1 June abantwana baya reporta esikoleni ugrade 12 no grade 7. Lamanye ama grade uzobuya futhi azonitshela ukuthi baya nini esikoleni. Nhleketa kuyibulawula isichangani because nathi basho ku South Africa kunati rimta kutala isichangani kombela vatswari hinkwavo swa ku va pfumelela vana va tlhelela eswikolweni hi ti 1 ta June. So hamikombela and hi khomisaneni mi nga va tshikeli department ya department ita vona i ntirho wa hina hinkwerhu vatswari mathichara na department. So hi khomisaneni loko kuna ngozi hi ripoteni ngozi leswi ka en'wana le wa vabya ina mavabyi ange exikolweni i ripote mhaka leyi ene hi vona swa ku hi mpfuna njhani a nga tshami kaya. So ngiloko lengikushoko lo namhla lesihlangene ngako la silitiko simele wonke ema province. Minister uyiphendvulile le yokuthi utawakhanini lama letikolo leti 1755 leti vandaliziwe. Ku vandalizwa abasho ukuthi vele sesifile tikhona yebo letshisiwe nalapho futhi skolo ne department provincini bane plan yokubona ukuthi benda njani ukuthi bantwana bakhone kuya esikolweni kutawusetshenziswa emahholo emphakathi kusetshenziswe emasonto kusetshenziswe noma ngabe yini ukuthi bafunzi baka grade 12 nangabe namele baye esikoleni ngamhla ka 1 batawuthola indzawo yokuhlala. Uthi lo munye la minister uma kwendekile ukuthi teacher utholakala upositive sesimquarantine njani angeke aquarantine esikolweni. The teacher cannot be quarantined at school. The protocols that are used now are going to apply if a teacher is found to be positive, not only a teacher, any other South African. If you are positive, you are quarantined. And there are different methods and forms of quarantining. So that will be applicable. But if it happens that a teacher at a school is found to be positive and then the school is closed, that school cannot be closed forever. It may be closed for a day for disinfection and deep cleaning and all what these big terms that fumigation, whatever, that then after all that has been done, then the learners will go back to school. Just like in any home. If somebody is positive at home, we don't vacate that house, but it gets disinfected. Then we go back to the house. So that's what will happen. Not to say that a school will be closed forever. What is the date? We indicated that the date for the returning of the other grades will be announced soon. Was the decision consulted with health experts, the NCC, the National Command Center has, when taking this decision, have they consulted? That team is led by health. So, and there is nothing that education will do alone without working with the Department of Health. Department of Health on all these matters of COVID-19 is leading. So, and they cannot allow the Department of Education to proceed if they see a danger ahead. They will call the department and say, hey, there's a danger here. Don't continue here. This school is not ready. This place is like this. We are led by the Department of Health. So I don't know what is it that we want, like let's say want something written in black and white that there was there a consultation and the national, international benchmarking want it in black and white. And what we're reading from United Nations is in black and white. I was reading and Minister was also reading. So I don't know what other black and white is needed. And this information from the UNICEF and United Nations and ever will be put also in the website of the department. Anyone who will want to view it will be able to see it. Minister, I think I've covered those questions, unless DG has some questions which we have not covered. But ngilogo lesicela kona bantu base South Africa, fellow South Africans, siyanicela sibambisene na wonke umuntu, siconsultile wonke ma stakeholder, ma SGB, ma union abo tishera, ma tinhlangano tebafundzi, tinhlangano tema civil society, sikhulumisene nato. Yebo angeke sivumelane 100%, kodwa kube khona nje kuvisisana sithe ukuthi asisebenzeni, kodwa babe basichushisa bathi bukani lokhu nalokhu, bukani lokhu nalokhu. And ngiloko lokusitako ukuthi i-report yethu every day iya improve ngema inputs wabo. Sanza kubabonga egameni la minister, kubabonga kakhulu lenhlangano lethi besolo sihlangana nato, nanamhla solo sihlangene nabo imini yonke. Luvo lwabo lusebenzile kakhulu ukuthi sibe ne presentation lekahle lesinika isiqiniseko sokuthi ngamhla ka1 June bantwana baya esikolweni. Ngiyabonga.
Thank you so much, Minister. Thank you so much, Deputy Minister. Thank you so much, DG. Ladies and gentlemen, we've come to the end of this briefing, but let me alert you that the different provinces, the MECs, will also be conducting media briefings in the next few days to provide an update on their state of readiness in the different provinces. So you will also be able to ask some of the questions there which are seeking detail to some of the issues that are relevant. Thank you so much. We really appreciate it.
Thank you. Thank you. Questions that are on the WhatsApp. Where is it going to finish?
He must reschedule,